What happens if I have surgery scheduled but I have a cold? Imagine this. You have surgery scheduled for weeks or months. You've already mentally prepared. You've followed all the medical instructions and suddenly, boom, you catch a cold. You'll ask yourself, is it safe to have surgery? Are they going to cancel it? What risks are there if I go into the operating room like this with a runny nose and mucus? Today we'll resolve all these doubts and explain step by step what to do if you have a cold. Don't miss this key information that would make a difference to your safety and recovery. The first thing you should know is that not all colds affect surgery in the same way. There are mild cases in which the operation can go ahead, but there are also situations where postponing it is the best option. What factors are taken into account? The severity of the symptoms. If you only have mild nasal congestion, there may be no problem, but if you have a fever, a severe cough, a cough with phlegm, difficulty breathing, then the situation changes. The type of surgery also has a lot of influence. It's not the same as minor surgery with local anesthesia as performing major surgery with general anesthesia. Also, your health status is. It is important if you have other illnesses such as asthma or a cold, as it can greatly complicate anesthesia. If you have any doubts, it is best to contact your doctor or anesthesiologist to evaluate your specific case. The main concern when you have a cold and need anesthesia is how it affects your respiratory system. What risks can there be, for example, increased mucus production during a cold? The airways produce more mucus than normal. This can obstruct the airways and make intubation during anesthesia a little more complicated. Coughing and defense reflex. General anesthesia suppresses natural cough reflexes, which can increase the risk of accumulation of secretions in the lungs and cause respiratory complications. The dreaded bronchospasm, which is a situation that the patient can survive in most cases, but it is a critical situation in the operating room. If you have a history of asthma or COPD, a cold can increase the possibility of spasms in the airway, making oxygenation difficult during surgery. For these reasons, the anesthesiologist evaluates whether it is safe to proceed with the surgery or if it is better to wait a few days until your respiratory system recovers. This is important because bronchitis is not a game. The airway is so reactive, your trachea, your bronchi are so reactive that when a tube is inserted there, and since the tube is a foreign body, your body will detect it and can close it. Your airway, and as I repeat, it is a critical situation if it is not resolved in time. That is why we avoid these types of complications in the ward until you are a little better, until you are without this reactivity in the airway, without this bronchial reactivity. And let's not forget about children too. Aren't children much more reactive? Eh? If they have a cold, their airways can be a little more reactive, causing bronchospasm as quickly as possible. Isn't that why, if your child also has a cold, it's better to wait for the cold to pass and intervene? When is it recommended to postpone surgery? As I tell you again, it's not always necessary to postpone surgery due to a cold, but there are situations where it is recommended to do so. Not where there is a fever greater than 38 degrees. Doesn't it mean that the body is fighting a stronger infection? When there is a persistent cough with phlegm, it can make breathing difficult during and after anesthesia. If there is dyspnea or difficulty breathing, or if you have a completely blocked nose or feel tightness in the chest, anesthesia could be more risky, and chest pain or wheezing are the whistling sounds from the bronchi, not from the lungs. When the lungs whistle, right? And it's a sign that the airways could be compromised because of that. If you experience any of these symptoms, your surgery may need to be rescheduled to ensure your safety now. What to do if you have a cold and your surgery is near? If you notice the first symptoms of a cold before your surgery, there are some measures you can take. Stay well hydrated, drink water and warm liquids. It helps to dissolve mucus and maintain the airways. Adequate rest is also important. To use ginger honey lemon infusions to soothe the throat and reduce congestion, and avoid medications without consulting your doctor. Some decongestants can affect blood pressure or interfere with anesthesia. That is why it is very important that you are seen by medical personnel. Do not self-medicate, and if the surgery is very close and you still have symptoms, it is best to notify either your surgeon or the anesthesiologist, because we can really deal with a very big problem especially the good for you, since you are going to be the person who is going to be operated on, and acting with the truth will save you from many things. Now, if your surgery is urgent or the symptoms are mild, it is possible that the procedure will still be performed, but in these cases, the medical team will take additional precautions. For example, if your surgery is on the lower part of the part from here to the bottom, whether it's the lower limbs or the abdomen, can't we opt for spinal anesthesia, regional anesthesia? We have to monitor you more, eh? At the respiratory level, eh? Use medication to reduce nasal congestion before the anesthesia, and use oxygen or not in the postoperative period if necessary. In conclusion, having a cold before surgery doesn't always mean that the operation should be canceled, but it is essential to evaluate the severity of the symptoms and the risk associated with anesthesia. If you find yourself in this situation, communicate your symptoms to the doctor so that they can make the best decision for your safety. Now, tell us in the comments if this has ever happened to you, or if you have questions. Don't forget to subscribe. Or if you have any questions, you can also leave them in the comment box. Don't forget to subscribe to receive more content like this every week. And if you want to know more, if you are going to undergo surgery and don't know what awaits you, whether it is general or regional anesthesia, I have designed 2 guides that may be very useful for you. You can download them from Amazon Kindle or from Apple Box. More information in the description of this video. See you in the next one.